Welcome to Marin Voices and Views. With Lawrence A. Strick, I'm Peter B. Collins. In our second segment today, we'll be joined by Farhad Mansourian, General Manager for SMART, and he'll give us an update on the new passenger rail line connecting Marin and Sonoma counties.
First, Peter, we're going to look at Proposition 46, which is on the November ballot. By way of introduction, people know I'm a trial lawyer and I fully support 46. And the reasons are threefold. One, it's going to save lives, it's going to help troubled doctors, and it may more fairly compensate individuals who are victims of malpractice. Here's how. Firstly, it addresses an epidemic in prescription drug abuse that's going on in this country, particularly painkillers like Oxycontin and Vicodin. If 46 is approved, it's going to require doctors consult the Cures database, which is already operating in California. But it stands for Controlled Substance Utilization Review and Evaluation System. Right now, it's only being used by 8% of the doctors. It should be used by more, and it should be mandated. Secondly, 46 calls for random drug testing of doctors, similar to that which is in effect for airline pilots. Lastly, it will raise the cap on non-economic awards for injured victims if they prove their case in court and are seeking damages.
Bob Pack, the author of Prop 46, joins us today. Welcome, Bob.
Thank you for having me.
Almost 11 years ago, you suffered an incalculable loss as your 10-year-old son Troy and 7-year-old daughter Alana were killed on a sidewalk in Danville by a driver who was impaired by several prescription drugs. Jimena Barreto was later convicted of murder, and we learned that she had received thousands of powerful pills from multiple doctors at the same hospital, who apparently failed to review her history before writing those prescriptions. Now, partly due to your efforts, this issue has gained national attention. This year, the governor of Vermont said that opioid abuse is the biggest problem in his state. Can you give us a sense of the extent of this problem, please?
Well, it's really an epidemic, and I'll give you some numbers that justify why it's being called an epidemic. In California alone, in 2002, there were 3 million narcotic prescriptions written in California. Last year, there were over 50 million. That's a huge growth number in the number of prescriptions written in California. And this is just a trend nationally. And so states are trying to do something about it to combat this. And one of the most predominant effective tools in fighting prescription drug abuse is through a tool like our state's Cures database, which is an electronic database that allows doctors and pharmacists to access to understand a patient's history.
Bob, tell us about the Cures database.
Well, the Cures database was kind of formally set up in 1997, and it requires pharmacists to submit any narcotic prescription to the Department of Justice in California and enter it into this Cures database. And so that data, since 1997, has been basically sitting there. And after the deaths of my 2 children, I realized, while having a technology background, that in order to help this situation and curb this overprescribing is to get that data online and allow access to it in a real-time setting from the doctor or the pharmacist from their place of work to understand if that patient is doctor shopping for extra narcotics or not.
Mm-hmm. Now, Bob, opponents of Prop 46 claim that this Cures database is underfunded and could leak confidential patient information. What's your response?
Well, that's not true. In 2009, the electronic database Cures went live for doctors and pharmacists. I spent 3 years helping develop it and get it through the state Senate and working with Jerry Brown when he was Attorney General. And I chaired the committee to help design and architect that online database. And it's very safe. There's limited amount of information that's in the database. It has the patient, the quantity of drugs, the type of drug. And this is the needed information for doctors to determine whether that patient needs it or not. And you know, it's managed by the Department of Justice, very safe, and has never been hacked in 17 years. And it did have some funding problems because of the downturn of the economy some years ago. But in 2012, so recently, I was involved in a Senate bill with my senator to provide long-term funding for the Cures program, and that bill passed. And so now it has a pool of money, $3.5 million, and the DOJ is working to upgrade it to accommodate the approximate 200,000 doctors, pharmacists, dentists that will need to access that data.
In 1975, a cap, a limitation was placed on non-economic damages in medical malpractice lawsuits. That is to say that if you lose a loved one, particularly a child or someone older, regardless of how you experience that loss and what a jury may think about that, you're limited in getting $250,000 for that loss. And it hasn't been changed since 1975. What are your thoughts on the cap, and how does that play in this initiative?
Well, for me, it affected me just like the prescription narcotic issue that led to my children's death, because I wanted to bring the multiple doctors to court and make them accountable for this reckless prescribing. And I wanted to do it mainly to change their internal protocols of how they prescribe and to institute safer standards. And so the issue became the $250,000 limitation on what's called non-economic damages, and mainly that refers to pain and suffering or death, and death of someone who does not have a substantial income, like a child, a stay-at-home mom, or an elderly person. So what the state law says is if you fall into that category, the most you can sue for on medical negligence, no matter what happened, is $250,000. But the catch-22 is the fact that you can barely get to court for $250,000 in today's money. And so lawyers can't take these cases because they're not economically viable. And so now what happens is someone suffers the death of a child like me, and then you suffer a second time because you can't even get to court. You get no compensation, you get no accountability, and no closure. And it's really harmful for victims because that accountability is important, because it's the only thing that will change the doctor or hospital to make their practices safer.
So Bob, I support 2/3 of Prop 46. The Cures database for me is easy to support, and the reform of the cap called MICRA is something that is long overdue. But the random drug testing of doctors is really a deal breaker for me. Like any other workplace, I think doctors who are drinking or on drugs while they're working should be suspended or have their licenses revoked. But doctors are people too. And if they have the right to use medical marijuana, alcohol, and even prescription painkillers within the law. So I think the drug testing element of Prop 46 is bad law.
Well, I don't think so at all, and I'll tell you why. I would ask the general public, would you fly on a commercial airliner today if you knew that pilots were not drug or alcohol tested? And would you feel comfortable and safe with that? And I think you should have that same outlook when you go in to a doctor who's going to perform a surgery, or an anesthesiologist is going to give you very dire type medication. You should be able to feel just as safe as when you're flying on an airline, that industry patrols itself and can confirm to you that they have a level of safety standards set in their profession. And the issue is that we're not trying to catch doctors. This is more of a deterrence, and that's why it's so effective in other professions like police and pilot. It's a deterrent system. If they know they're going to be drug tested at their profession at some random time, they need to be clean when they go to work. They can smoke marijuana on the weekend and they can drink their wine out on a Saturday evening. They just cannot show up to work with that in their system when they're tested.
Well, one of the elements in Prop 46 basically suggests that if there is an adverse event, that immediately the doctor is supposed to submit to a drug test. However, the determination of an adverse event is not always obvious at the moment. And so I just think that there are some real serious problems with the drug testing element, and it's why I can't vote for Prop 46.
Well, an adverse event is determined by the hospital. If there's an adverse negative event, then that doctor needs to submit to a random drug testing within 12 hours after they discover that it was a negative event. And maybe it'll work because maybe they test the doctor and maybe there was an issue, particularly around prescription narcotics, which is the most abused medication by doctors because of easy access to it. But if it's time later and he's determined not to have any impairment, then that's fine. He goes on his way. There's a really safeguard built into this system, and that is they're not automatically suspended or deemed illegal at the time. The medical board is in charge of this testing, and the medical board has an officer that meets with the doctor, and if they have marijuana in their system or some drug, Vicodin, but they're taking it legitimately, then all they have to do is explain that. And if that medical officer determines that's valid, it never even gets reported to the medical board. But if he can't substantiate why there's a large amount of OxyContin in his system, no medical reason, it does get reported to the medical board.
I've found it interesting that the insurance industry, the medical insurance industry, is spending up to $57 million to fight this proposition. The groups for it have about 10% of that. Have you been surprised at the amount of money that's being spent to stop this proposition by the medical industry?
Well, I am now, because when we started, I knew they would put some big money, but I never knew that they would be putting up $58 million right now in the No campaign. And 45 million of the 58 comes directly from several big medical malpractice insurance companies in California. And they're sort of the pink elephant in the room to me because they're not out front in this campaign. They've never been interviewed in this campaign by any of the media. And the reason is they want to keep quiet is because for 40 years they have not had to pay victims who do not have incomes and either killed or maimed by medical negligence. So they've had this free ride, and that's why they're extremely profitable. In fact, those big insurance companies in California are the most profitable in the nation by a wide margin. They only pay out 38 cents on the dollar to in malpractice claims. The national average is over 60 cents.
You're talking about insurance companies that specialize in protecting doctors.
That's right. The specialized that covers doctors for medical negligence, and they're getting away with not having to pay people. And it's, in my view, it's against the Constitution right to everybody has a right to a jury trial for any harm, whether it's a doctor or you're walking down the sidewalk and a crane falls on you. You should have the right to go to court and let the jury decide. The egregious part of this is oftentimes victims are given a jury award for, say, a death of a child of $2 million or $3 million, and immediately the judge is required to knock that down to $250.
Bob Pack, the author of Proposition 46, thanks for joining us today.
Thank you for having me.
Joining us now is Farhad Mansourian, General Manager of SMART, the Sonoma Marin passenger train that was approved by voters in both counties in 2008 and is now under construction. Starting in 1980, Farhad worked for the county of Marin and rose through the ranks to become director of the Department of Public Works back in 2002. In that role, he was an early organizer of this new transit system and became SMART's general manager in 2011. With a target launch date of late 2016, there's a train that's coming to take some of the traffic off Highway 101. Welcome, Farhad.
Thank you for having me.
You've taken on a big challenge to build SMART, and if you'll pardon the expression, it hasn't been easy to keep it all on track. Voters approved a train from Cloverdale to Larkspur, and then the 2008 recession cut your sales tax revenues and in turn limited the amounts that you can borrow. Most recently, a $20 million federal matching grant for the San Rafael to Larkspur leg fell through. So the first phase will be Santa Rosa to San Rafael. Will SMART eventually live up to the original vision?
You know, our board is directed the staff, and they are committed in doing everything possible to fulfill the original promise, which is Cloverdale to Larkspur, as well as building as much of the bicycle pedestrian path as we financially can. And as you mentioned, you know, we had one of the biggest recessions in the recent history. And my board, you know, a courageous board, had to make very unpopular, politically dangerous decision, and they decided to live within their means. Instead of just, you know, pretending nothing has happened, they made very, very unpopular decision and phased the project. And that's the phase that we are building. But let's look at all the good things we've done in the last 3 years. When they phased the project because of the recession, we were going 34 miles and 6 stations. In 3 years, having leveraged local sales tax with other grants from state and federal government, we're now going 43 miles and 10 stations. We haven't given up, and we will continue seeking other funds, and until we get to Cloverdale and Larkspur and our bicycle pedestrian path, our job's not done.
Let's focus a little bit about the engineering of SMART. Is it a single rail right-of-way, or does it put together some existing freight line track that takes us south from up in Santa Rosa? Describe that for us.
Great question. You know, back in the 70s and late 70s and early 80s, a group of Sonoma and Marin County supervisors who had a vision that we need a significant infrastructure work with, I believe, Congressman Bosco, who was the congressman at that time. And together, they found money and they preserved the entire old railroad right-of-way for public use. And the freight had given up at that time, the passenger service had given up at that time, and they were going to sell this and tear it into chunks and chunks. And these guys had the vision, and they preserved all of that. That's what we're operating on. So SMART owns the following property: from Corte Madera all the way north to the middle of downtown Hillsburg. And then on Highway 37, we own everything all the way to Napa. That is SMART's right-of-way. Now, having said that, we're required also by law to allow the operators of freight service to use everything that I just mentioned north of Highway 37. South of Highway 37, there is no planning for any freight. So we operate together. We are the owner and they are our tenant, and we will coordinate together as we do right now. As you know, freight is operating a few times a week. And once the passenger service starts in just a couple of years, we will dispatch everything, and we have to coordinate their movement and our movement.
Is Northwest Pacific Railroad the line that you're talking about?
Correct. They are owned by a separate government entity called NCRA, North Coast Rail Authority. NCRA, in turn, has hired NW Pico as their contractor.
Have they been complaining about some of these issues?
Sure, because they are very eager to get their business going, and they are asking us, SMART, to pay for a lot of connection to the businesses. My board is committed to expand the business opportunity, and by the time we finish, we have spent approximately $10 million in improving the rail line for and getting them ready for the freight operation. And $10 million is about the budget that we can afford at this point.
Will that defray some of the cost for passengers ultimately?
No, because this is what we had money to do. Now we're asking the freight and their business partners if they want connection, and it makes engineering sense, and it's not connecting to us behind a blind curve or anything like that, then they need to come in and they need to pay for the expenses of the connection. It's part of connecting to an active railroad.
Farhad, there seems to be some confusion about the plans for the San Rafael terminal, about exactly where it'll be situated, whether it'll be pretty enough, and how it will interact with the existing bus transit hub that people are familiar with in San Rafael. Can you help clear that up for us?
Sure. Thank you for asking this because it's a very good question. But I want to start correcting some of our terminology, which will help. SMART has a state-of-the-art, very quiet, and extremely environmental friendly train that has not been ever built before. The pilot vehicle is being built for us, delivered to us next spring. So this is a brand new vehicle. It's about 4 feet high. And you remember the old trains, you had to grab a bar and pull yourself up. Well, today with the wheelchair accessibility and people with vision impaired and moms with babies and strollers, that was not practical. So the board of directors wanted to make sure we have what we call level boarding. Just like BART, you come on a platform and you go straight in. That requires our platform to be 4 feet high. These platforms, not terminals, not stations, not a place to welcome people in town, these platforms are roughly 15 to 20 feet wide, about 300 feet long, enough to have 3 cars parked there. And that's all these are. And these need to be a very practical. Each train will stop at each station somewhere around 30 seconds. The doors open up, you get in, people get out, the doors close, and we move on. There has never been an intention for us to turn these practical platforms as anything other than that. We're not building, gorgeous station that some other people vision. We don't own the properties. And all of our effort is to go to Cloverdale and go to Larkspur, which means we have to be frugal in our expenditure, be practical, be tasteful, but not come up with anything, because remember, we still need to go to Larkspur, and there are 3 stations in Sonoma that we have not completed. So, we hear people, they love to have the best of the best of the best, but we're only building a practical platform. It is very similar to what it is across the street at the San Rafael Transit Center, which is benches, a garbage can, a station where you can get reports and a cover, and you wait there till the bus comes and you go. And that's what we have.
Is San Rafael a little jealous because Santa Rosa has Railroad Square and Petaluma has a kind of legacy train station? Is that
I'll
kind of
defer you
thing?
to the city officials to ask that. Our job, again, is to build and go further and further while we have practical and tasteful facility at every one of our stops.
The civil grand jury in both Marin and Sonoma have looked at this. And in Sonoma, they issued a report this summer that said your staff has shown resourcefulness and prudent control of the finances, particularly in the face of the lower funding. Yet it seemed to fault you and the board, or your board, for some failings that kind of went back in time. How do you respond to that report?
My board last Wednesday considered the grand jury report and provided a full report. I'll urge you to go online and look at that. In summary, my board completely disagrees, and they responded point by point to the findings of grand jury. It is very easy for a lot of people to say, sure, I knew the recession was coming. Well, who knew? What hit us was not a California or a Marin County, was a worldwide recession. And for people to now say you should have seen it coming and you should have done this and that, well, as a matter of fact, my board did that. And I'm saying that because I wasn't with them before, so I'm not defending them. This is the truth. They made difficult political decision and faced this project. They lived within their means. Are we ready for the next one? We definitely are. We stock away reserve, and this is what we do in both capital and operation. How big is it going to be? How long it's going to last? Who knows? Maybe the geniuses can figure that out.
Farhad, the big question, what's a ticket going to cost? And will it be affordable enough to get me out of my car and take the train to Santa Rosa or some point in between?
You know, let me answer your question this way. Last week, we released a survey, which, by the way, it's on our website, and I urge you and the viewers to go look at it. We surveyed just about 1,000 people in Marin and Sonoma, non-political survey, asked them a lot of good questions about where you're coming from, where you're going, what do you want to see on the train. We also asked them, how much are you willing to pay? And on purpose, we put in a low amount of $5. But also put in 7, 9, 12, just to test the market. According to the pollster, he says amazingly, while 45% said they like to pay the smallest, the $5, this is each way, the other 48% said they're willing to pay 7, 9, and 12. And here is why. Right now, if you get during the commute hour on Highway 101 from Santa Rosa to come to downtown San Rafael, you're stuck for about 90 minutes. We'll get you there under 1 hour. If you're going from Novato to Marin Civic Center during the morning commute, 45 minutes to an hour. We get you there in less than 10 minutes. So, let me ask you this. 10 minutes at the train ride with Wi-Fi and a latte to buy, 50 minutes on Highway 101. How much are you willing to pay?
You're a master of the value proposition.
Very good.
Farhad Mansourian from SMART, thanks for joining us today.
Thank you for having me.